Hello everybody and welcome back to the 2021 HypnoSummit. Last year I watched the summit from my holiday in Greece. We stayed in the most gorgeous area of northeastern Greece. When you look at a map of North Greece, you see 3 peninsulas poking into the Aegean Sea. The hotel I stayed in is on its own tiny peninsula that comes off the middle of the 3 larger peninsulas. Surrounded by the Mount Athos Gulf, overlooking the Isles of Vaburu over there, Mount Athos over there. Every morning I took myself onto the balcony with my computer to bathe in the sunrise whilst listening to the HypnoSummit talks of the previous day. I'm sure you can imagine the vivid turquoise colour of the sea, brightening as the orange sun rose over the mountain. It really was the perfect painting. I thoroughly enjoyed the presentations that I watched. And alongside my own personal backdrop, I have fond memories of the HypnoSummit 2020. I'm overjoyed to be here speaking to you all today, albeit with a slightly less idyllic setting, though I must say the sun's come out in England today and I'm getting to wear my summer clothes, which I haven't been able to wear much this summer. It's not been the best. And I hope to inspire you in the same way I felt inspired last year. The funny thing about this digital world we find ourselves in is that you can see me, but I can't see you. This year I've been part of some other things online, and it's always the same setup. I can only see myself. I recently met someone who had tuned in to something, a mental health clinic I've been running every week. He said to me, "You don't know me, I know you." What a bizarre circumstance. I often catch myself staring back at me from the computer screen. It causes me to look at myself until I realise that when I look at myself, I'm not looking into the camera. And so I flick my eyes back to the camera. But then I can't see myself and I feel pulled to check I'm looking at the camera. Of course, this results in some weird eye flickering between myself and the camera, One day we'll get used to this and I'll perfect my technique. The lovely thing though, good technique or not, is that I'm able to connect with all of you, many of whom it would be difficult to come face to face with in a previous world. And for that, I am grateful. So, without going on, I should begin this talk. Let you know, my name is Juliet. I've been a general hypnotherapist since 2008 and a hypnobirthing practitioner and trainer since 2010. I'm also a birth doula. For those of you that don't know, a doula is a trained companion who is not a healthcare professional, but supports another individual through a significant health-related experience. So you'll find doulas that support others through miscarriage and abortion, or stillbirth and death. My goal and role as a doula, or as a birth doula, is to help my client feel safe and comfortable, complementing the role of the healthcare professionals who provide the client's medical care. Unlike a physician, a midwife or nurse, I, as a doula, cannot administer medication or any other medical treatment, or even give medical advice. So, over the years, I've worked with many pregnant people and their birth partners as a hypnobirthing practitioner, a friend, and a birth partner. Unless it was a traumatic experience, anyone who has watched someone give birth will probably agree with me that it's the most incredible thing you will ever see. It never dampens. Birth always leaves me with my jaw dropped in awe. If you ever get the chance to sit alongside someone as they birth their baby, I urge you to do it. It's really amazing. When my colleague Sue and I wrote the Fertility to Birth Hypnobirthing programme, there were very few hypnobirthing schools around. I think I could probably name you 5. Hypnobirthing was something that we knew all pregnant women, alongside their birth partner, would benefit from. It appeared to only attract those that were seeking an alternative. And by alternative, I mean alternative to the recommendation of the midwives and doctors. Sometimes just a home birth was considered alternative, and in some countries it still is. So before I continue, it's probably important for me to say that I'm in England and for the most part, I speak about the regulations here. All countries have different rules, and in some, home birth is still considered illegal. Nowadays, hypnobirthing is increasingly popular. Some hospitals offer hypnobirthing courses as part of their antenatal package. Many people take a hypnobirthing course regardless of their birth preference. Hypnobirthing is recognised by most people, and almost everyone has heard of it. Certainly here, since the Duchess of Cambridge regularly speaks about using hypnobirthing during pregnancy and birth with all 3 of her children. I imagine one of the reasons you have decided to watch this presentation is to find out exactly what hypnobirthing is. And I hope by the end you have a clear idea and feel as passionate as me about the benefits. In a nutshell, hypnobirthing is a birth education program that helps a birthing parent understand and feel in control of their pregnancy and birth experience. Hypnobirthing covers the physiology of birth, the regulations of the care provider, and gives techniques to help the birthing person remain in control and informed, ensuring the entire experience is consent-based. I don't know anyone that learned exactly what happens within the body when it births a baby. In fact, I only really got to understand myself when I became a hypnobirthing practitioner. Essentially, procreation is the thing we were born to do. Wonderfully, we now have heaps of other things to make life meaningful if we choose not to have children. However, from an evolutionary, gene's-eye view, the purpose of life is to make babies and help genes survive through the generations. In the UK, when we're in our early teens, we learn how to not make babies, and we learn where a baby comes from, not the belly button apparently. Rarely do we learn the specifics of what makes a pregnant body birth a baby and how it does it. I have vague memories of being in a classroom at school and watching a video of a woman giving birth. It didn't show me how that happens from within though. Just very short clip of a baby being born. It failed to give the hours leading up to the birth. Perhaps descriptions of the hormones and their purpose would have been helpful. The muscles of the uterus bunching at the top of the uterus before they then use all their force to push the baby down and out. I didn't learn that the uterine muscles push the baby down, and it's not a conscious action. Did you know that a pregnant person in a coma can give birth? It's pretty amazing, actually, what the body can do. So birthing a baby is a natural process that requires no conscious effort. So why do we hear of so many women being told to start pushing? Questions like this that a hypnobirthing course answers. I believe that in our developed world, technology causes disrupted interoception. Have you seen people that check their watch to make sure they have moved enough that day? 10,000 steps? I bet some of your friends even have a device that tells them when to drink. Do you receive a notification when it's time to go to sleep? So much of our lives are technology-based. So few of us follow our natural instincts and intuition. The availability of medicines makes it possible for us to avoid suffering in a way that no previous generation from any era could. However, in many cases, medicine just masks the symptoms of our illnesses, discomforts, and disorders without addressing the underlying disorders that cause them. They take away the feelings, and we become less aware of the natural workings of our human body. We lose the ability to feel, explore, and understand what is going on within our bodies. And most importantly for birth, we begin to fear anything that feels different to what we're used to. By using hypnobirthing to become aware of the physiological process of birth, new physical feelings become expected rather than shocking. The fear is lessened and the body can function efficiently. Hypnosis techniques enhance a person's ability to focus. The hypnotherapists amongst us will all probably know the analogy of a sports person who gets into what we often call a zone before a big event. Using hypnosis techniques learned in a hypnobirthing course and then practiced during pregnancy enables a birthing person to get into their zone, fully connecting the mind and body. In the UK, we have the National Institute for Health and Care Excellence. We call them NICE. They write clinical guidelines, and we call those the NICE guidelines. NICE state that their clinical guidelines are recommendations on how healthcare and other professionals should care for people with specific conditions. The recommendations are based on the best available evidence. The NHS adhere to the NICE guidelines. Unfortunately, due to the way the NHS functions, the guidelines cannot be personalised. Therefore, care is less personalised than in an ideal world. Some people choose to employ an independent midwife to personalise their care. However, this is expensive. When a pregnant person chooses hypnobirthing, they take authority of their body and their experience. They use the knowledge and tools gained in their hypnobirthing course to command informed consent, making sure the care they receive is personalised and not generalised. In the UK, many hospitals offer antenatal courses as part of the NHS service. My local hospital, for example, offers several courses. These are all included in the NHS service. First off is the online Your Pregnancy Matters class. The course is designed for people between 12 and 18 weeks gestation. The course gives information on the services provided by the hospital during the antenatal period, the options for the place of birth, and health information such as diet and exercise, managing common pregnancy complaints like nausea and constipation, when and how to contact the maternity unit, the importance of monitoring the baby's movements, and what to do if there are concerns. The second course is another online course titled Antenatal Workshop. This course is a 4-hour course over 2 sessions and for people around 26 to 34 weeks gestation. It covers signs of labour and when to contact the maternity unit, ways to promote the helpful labour hormones, stages of labour and pain relief, what to expect in the early days after having a baby, including the physical and emotional changes in mother, the golden hour, cord care and nappy changing. The final antenatal course is titled Physical Preparation for Childbirth and is run by a physiotherapist. It covers ways to minimise discomfort during pregnancy, exploring posture, back care, core stability, pelvic floor exercises, and exercising during pregnancy, alongside an understanding of how labour positions, breathing techniques, relaxation, massage, and TENS machines can ease labour. This course covers positions for the second stage of labour, breathing techniques, instrumental deliveries, and caesarean sections. These courses are all provided by our NHS and free of charge. We also have a very popular organisation called the National Childbirth Trust. The NCT established in 1956 as the Natural Childbirth Trust. Their mission is to share knowledge, create networks, and change public policy and attitudes for good. They do this via several methods, but the most well-known is their antenatal courses. At one time it seemed that you didn't do pregnancy without an NCT course. In years gone by, most hypnobirthing couples that I worked with also took an NCT course. However, recently, more people have chosen hypnobirthing as the only antenatal course they take. The NCT course covers 9 main sections, which closely relate to the NHS courses: deciding where to have your baby, local options and care, changing hormones and going into labour, stages of labour and birth, induction of labour and when help is needed, caesarean birth and recovery, helping yourself and supporting through labour and birth, pain management options, having a baby during COVID-19, meeting your baby and what happens immediately after birth. As many people choose hypnobirthing as the only antenatal course they take, the public expectation of hypnobirthing, in addition to the hypnosis aspect, is a whole antenatal programme in line with the NCT and the NHS courses. The benefits of hypnobirthing spread through word of mouth. Having a baby is an expensive affair these days. Through my work as a doula and my personal life as a parent, I know that we really need very little. However, the consumerist world that we live in dictates hundreds of pounds worth of things that every pregnant person needs to buy. I mean, I think back to my first daughter who we decorated a whole bedroom for when she was born, and I don't think she ever slept in it. Certainly not before she then moved into another bedroom of the house. There was prams that she didn't go in, cots that she didn't go in, clothes and more clothes and more clothes, clothes that still had labels in them once she'd grown out of them. My sister-in-law talks of her sister-in-law sending her a spreadsheet with so many different things that she was told she needed for the baby. So antenatal courses are an additional expense. If finances are not a concern, time is. The pressure to dedicate life to work leaves many feeling uncomfortable about taking time off for antenatal appointments. Evenings are often taken up with more work, and weekends for socialising. Time is short. It is for these reasons many people choose just one antenatal course. Most good hypnobirthing courses cover the information in the NHS classes and the NCT classes, alongside hypnosis techniques and tools to allow the body to function in a primal way, enabling natural processes to take over conscious actions. The feedback I regularly receive is that the people I work with learn more during the hypnobirthing classes than they did at their NCT or hospital course. They share this with their friends, and as a result, the general expectation of hypnobirthing courses being a cover-all course is high. Nowadays, many people offering hypnobirthing courses are not experienced hypnotherapists, or even therapists in any form. So many of these people credit a hypnobirthing course for their own fantastic birth. So they decide to become a hypnobirthing practitioner themselves. A course is rarely very long, it's quite inexpensive, and there is scope for making a lot of money. So it seems like a fantastic opportunity, especially for those mums who have chosen to give up their full-time job but want a little bit of extra money. These people are passionate and wonderful advocates of hypnobirthing. They certainly get the word out there. Many are also first-rate practitioners that deliver exactly what is needed every time. A qualified therapist has additional attributes that enhance a hypnobirthing course. I'm sure most of you have a good understanding of the neuroscience of the autonomic nervous system. You know all about the fight or flight response and what to do when the body enters it unnecessarily. You know about the mind-body connection and how to re-establish it. You know about trauma and what to do when someone experiences trauma. You know how to help people with their fears and anxieties. You know how to help people increase their confidence and express their authenticity. There are so many qualities that come from experience working as a therapist that are hugely relevant to hypnobirthing. A large part of hypnobirthing is the physiology of birth, the antenatal course if you like. Some people worry that they need to have experienced birth themselves before they can educate others. This is not necessary at all. In the same way that very few doctors have experienced the ailment they treat, and having given birth is not a prerequisite of becoming a midwife. You do not need to have given birth to help others with hypnobirthing. You also do not need to be female. I've trained some brilliant male hypnobirthing practitioners. To me, hypnobirthing is an incredibly important facet of my work. When I hear the stories of those that previously experienced a traumatic birth, I truly appreciate the necessity of this type of work. If you feel interested in helping others, there is great scope for you to do so in this way. To some extent, the work is the opposite way round to how most therapists work. The focus is on prevention rather than restoration or rehabilitation. A hypnobirthing practitioner, without the additional tools, will offer a sufficient hypnobirthing course. However, when you have the therapeutic skills and you bring these in to the work, you take it to a whole other level. So much so that it is life-changing for some people. When you help someone to fully connect their mind and body, understand and follow their natural instincts, this will follow through into the relationship with their new baby. If any of you follow the work of trauma or attachment experts such as Gabor Mate or Diane Paul Heller, you will know how important the attachment relationship between primary carer and baby is. Hypnobirthing is something that can help a parent understand their baby in a different way, so that the baby grows with a secure attachment. When you take hypnobirthing into the community, you help the next generation too. Speaking of the wonderful Gabor Mate, he describes trauma as not what happens to you, it's what happens inside of you as a result of what happened to you. Bessel van der Kolk, author of one of my most cherished books, The Body Keeps the Score, defines trauma as an experience that basically leaves people stuck in a state of helplessness and terror. Trauma starts with a feeling of, oh my God, my life is over. Mind and brain become overwhelmed, resulting in a change over how you perceive danger and what you consider relevant and irrelevant to your survival. So it makes sense then that birth trauma does not necessarily come from a birth with birth injuries or emergency situations. Birth trauma refers to the distress experienced by a birthing person or birth partner during or after childbirth. Condensing the definitions by Gabor Mate and Bessel van der Kolk, trauma happens when one feels out of control of a situation in which they perceive their life to be at risk. The helplessness and terror felt in this situation causes trauma. Research tells us that around 30,000 women each year experience birth trauma. It is common for most people to automatically assume physical damage when hearing the phrase birth trauma. This is not always the case. I remember many years ago working with a couple who felt so excited for the birth of their baby. They were possibly slightly unrealistic in terms of the physical feelings that most people feel when giving birth. However, I felt happy to enjoy their enthusiasm with them. They threw themselves into the hypnobirthing course. They followed all my preparation instructions in the weeks before birth. In fact, they were the only couple that in 11 years of doing this work caused my partner to come out looking for me because I'd been at their house for so long, way longer than expected. And he was unusually worried. On reflection, I think it's the only time in our 16-year relationship that's actually happened. Slight diversion there. They're a great family whom I still have contact with. However, their birth did not go to plan at all. She hoped for a natural home birth. The birth started ideally, but before long they transferred to hospital via ambulance because the birth did not progress typically. She asked for an epidural, and the baby was pulled out with forceps. There are so many parts of a birth like that which might cause trauma. However, both the birthing mum and her husband said afterwards that they felt good about their experience. Whilst it did not follow their dream birth plan, they felt in control at all points and felt that everything that happened was their choice. And that's key. It wasn't what they'd have chosen before the birth, but during the birth, it was their choice. They put this down to the hypnobirthing preparation. They were able to take control, to command informed consent, and make choices based on the information they had. It was lovely to watch them go on and have a natural home birth with their second baby. The other side of that coin is a client that had actually taken a hypnobirthing course with a different course provider, a course I know well. I'll mention no names, but whilst the course is mostly as brilliant as any other hypnobirthing course, there's one piece of advice in the hypnobirthing program that I've heard cause a few problems. This hypnobirthing course suggests people breathe their baby out rather than push. Any of you that have given birth before know that the pushing is much like a reflex and you cannot control it with your conscious mind. I think there was a slight miscommunication or misunderstanding for this woman, as her first birth caused her to suffer huge trauma. The birth on paper would read as a nice birth. However, when she spoke to me about it, the trauma was evident. She said, and I quote, "I spent 5 hours trying to stop myself doing a great big," I'm not going to use the word, bowel movement. She didn't think she should allow her body to push. She felt out of control of herself. She felt helpless and terrified of allowing her body to do what it needed to do. This woman was one of my earliest clients. I worked with her and her husband over 10 years ago, yet the terror in her face and the tears on her cheeks as she relayed that story to me, I still remember as clearly as the day she told me. Sadly, she didn't receive the support from the midwife that she needed in that moment. Perhaps she was so out of touch with her body's natural responses in everyday life that she just couldn't find the intuition in the moment. She used her conscious mind to fight her primal instincts and reactions. I also remember the couple that I worked with who used hypnobirthing to slow down birth. It was their third child. The first was a hospital birth that happened from start to finish in 45 minutes. With most birth horror stories revolving around the duration of birth, this might sound pretty cool. However, in reality, this is not a long time to recognise the physical feelings of birth, get yourself to the hospital, get checked in at the hospital, and then taken to a room. The birthing mum felt quite traumatised by the entire experience. Her second birth was at home, and she found the ability herself to use her mind to feel in control. She took a bath and used the power of her mind to maintain a steady pace. The birth was still fast, but controlled. For the third baby, I was there as doula. We had hypnobirthing sessions in the lead-up. The birth was beautiful. Slower again than the second, but still quicker than most. She birthed the baby in her new huge bath, and I believe she finally got her perfect birth experience. Many people incorrectly believe hypnobirthing is always about making birth faster and feeling free. This is not the case. I hope you are beginning to appreciate that hypnobirthing is, in addition to the general antenatal aspect, helping birthing people and their birth partners to feel in control of their experience, rather than finding themselves in a situation that they do not know how they got into and do not understand, with no confidence or power to ask. The effect of this will be that the body is able to function efficiently and optimally. The birth might not be a typical birth, but there will not be unnecessary pain or interventions. Any birth injuries, physical trauma, or emergency situations are easier to manage physically and psychologically without emotional trauma. Birth trauma happens to birth partners too, and leaves people with symptoms such as flashbacks, anxiety, avoidant behaviour, and difficulties bonding with the baby. Because of this, I'm a huge advocate of anything that helps prevent it. A few years ago, a lady contacted me and asked if I would be her doula. It was a new situation for me. For this story, I'm going to call her Ruth. Ruth and I had connections through my children's school. Ruth is an expat, living and working in England. The story with the baby's father is vague, but suffice to say he does not live in England and had little interest in the pregnancy. Ruth has friends. Taking on the role of birth partner is a big, massive commitment. Firstly, it takes a month of availability, possibly more if you're a friend. As a doula, I commit to being available in the 2 weeks before and the 2 weeks after the calculated due date. Outside of this month period, I try to be available, but I don't guarantee it. This availability must be 24 hours a day, 7 days a week. It's a lot to ask of a friend, and when you don't have a backup, you want the guarantee. So Ruth didn't feel comfortable asking any of her friends for that commitment. Ruth's mum was due to come over for the same period. Her intuition told her that her mum wasn't the right birthing partner for her. This story is unique for me because it's the only time I've been the primary birth partner when employed as a doula. Ruth's pregnancy experience felt tainted from the start because she was what the hospitals here call a geriatric pregnancy. This label is given to anyone who falls pregnant over the age of 35, which is young. Many people are having babies over the age of 35. For some midwives and doctors, this has risks stamped all over it. Ruth was actually in her early 40s, so extra geriatric, if you like. She also had a medical condition, which posed a few problems, but the age seems to be more of a concern to the consultant. The first problem Ruth experienced was pressure to have an induction preterm. It's not my responsibility at all in either hypnobirthing or as a doula to advise. I view my role as one of support and guidance. Through my network of birth professionals, books and other resources, I can direct people to further information. As birth partner, I support them in their decisions, which through their own research are informed. Ruth did not want a preterm induction. It went against her natural instincts and what she had researched. She asked me to attend a scan with her. At the scan, the consultant asked to speak with her about induction. Ruth politely said it was against her wishes. The consultant immediately started to tell Ruth she was putting her baby in danger. I was able to ask the consultant for the evidence base. The consultant offered some statistics, all off the top of her head. I felt grateful to have a book with me, written by a well-respected British midwife, Dr. Sarah Wickham. The evidence that the doctor gave was documented in the book, so I was able to cross-reference what the consultant was saying against the facts. Unfortunately, the consultant offered inflated statistics that would have instilled terror into anyone. The role of a birth partner is to support the mother. I simply asked the consultant to read the relevant page in the book. The risks of adverse situations are high for an older person. We can't deny that. However, not to the extent that this consultant would have the client believe. For an entire month period, Ruth received an intense phone call from the consultant, pressurising her to go to the hospital for an induction. The decision not to was her own and was made prior to employing my services. She did not come to me for advice or need me to help her to commit to her own decision. However, she did need me to listen and support her with the feelings that arose, such as anger and frustration, as a result of the medical team not respecting her wishes. Without a birth partner, she would have needed to deal with all of that alone. During the birth, my role was more practical. There was the hour when she wanted to stand, but the midwife wanted to hold a heart monitor on Ruth's abdomen. She couldn't. She didn't have enough hands to hold the heart monitor here and do all of the other things she needed to do over there. Without me there, the midwife would have put pressure on Ruth to lay on the bed, so she could have had the permanent heart monitor on her. I was able to hold the mobile heart monitor in the exact position that the midwife wanted, so then the midwife could go away and do the things that she needed to do. Simple things that prevent a vulnerable birthing person from experiencing feelings of helplessness. I could spend all day giving you different stories, but hopefully you hear that the role of a birth partner is to support the birthing person in such a way that they remain in control of the experience. The hypnobirthing course is designed for the birth partner too. There is the option for a pregnant person to take a hypnobirthing course alone, but I personally always recommend their birth partner join them. If there is hesitation from the birth partner, I will suggest that the pregnant person seek support from a second birth partner. To enable the birthing person to remain in the optimal state of mind at all times, there needs to be another person there to communicate with the care team, should the birthing person choose to remain focused and quiet. As the birthing person focuses their mind internally, remaining in the present and comfortable with the inner workings of their body, the birth partner will need to focus as powerfully on the birthing person and their surroundings to help maintain this calm, mimicking a natural environment as much as possible. Their connection is paramount. The birth partner will need to work instinctually to translate the birthing person's needs. An understanding of the physiology of birth is important to communicate equally with the medical team. The birth partner will learn how to guide the birthing person into the hypnotic state of mind, should they need it. They will also spend time during the pregnancy using hypnosis alongside the pregnant person, so they have an appreciation of how to tend to someone using this powerful tool. The birth partner needs to feel confident enough to question the medical team, secure enough in their knowledge and understanding of the wishes of the birthing person. It is the hypnobirthing birth partner's responsibility to advocate for the birthing person. Hypnobirthing sessions help the birth partner to increase their knowledge and feel confident in speaking out when necessary. Hypnobirthing sessions offer guidance on touch during birth, so the birth partner can use massage when it is helpful. There is advice on how to empower the birthing person at times of insecurity. The birth physiology part of the course covers an education on the hormones released during birth, including times of increased hormone production. With this knowledge, the birth partner will understand changes in the birthing person and times when they may need to offer different support. Hypnobirthing is a reconnection to nature, a reminder that we are nature and that we can function naturally. The birthing environment is often far removed from nature. When the birthing partner works on their mind and body connection using hypnosis and mindfulness, they bring that into the birthing environment, creating a tribal bond that will help the birthing person remain connected to their natural self. At the very least, hypnobirthing helps the birthing partner to feel purposeful. We hear many stories of the birthing person inviting someone to the birth, or even someone assuming the right to attend the birth as the parent of the baby or another family member. Some birthing people feel powerless to command a birthing partner as their much required support. Hypnobirthing helps the birthing person to view the experience as theirs, to own the experience, and recognise attendance at their birth should be by invitation only, and feel empowered enough to invite people that will help rather than hinder. Most birthing partners do want to help, but feel unsure of how to, often finding themselves morphing into the wall as they let the medical team take charge. This instantly creates a hierarchy in the room. An active, empowered birth partner will eliminate this hierarchy, bringing an equality to the team, so that the birthing person remains in control of their experience. I hope that this talk has helped you to appreciate the depth of hypnobirthing. Hypnosis is a wonderful tool, and when a person learns how to use it, they'll bring it into so many aspects of life. You'll hear some fantastic talks throughout this summit, and it's my reckoning that almost all of it you could bring into hypnosis for birth sessions in some way. Hypnosis during birth allows the birthing person to birth as nature intended. Natural does not mean perfect or ideal, and there are times we thank our lucky stars for the medical science that we have. Other times it completely gets in the way of a natural experience, and the interventions hinder what could have been. Having read extensively about meditation and hypnosis, I'm yet to find a distinction between the meditative state of mind and the hypnotic. I recognise that hypnosis is more often used with a goal in mind, and meditation to clear the mind and bring it to the present moment. I'm very keen to have a conversation with anyone who can share further wisdom on this subject. When someone learns how to meditate or use self-hypnosis, it becomes a lifestyle. Meditation helps one to live mindfully, and the insight into oneself gained from the introspection during meditation or hypnosis helps one to feel truly aware of their own feelings, physical and emotional, and take control of reactions. This permanent way of thinking and being helps birth happen more naturally than it otherwise might in a medical setting. The birthing person's increased mind-body connection helps them to welcome and ride the feelings of birth rather than fight them. There is, however, an important distinction between hypnosis for birth and hypnobirthing. Hypnobirthing is a full antenatal program. It includes hypnosis as a form of guided meditation with the intention of helping the birthing couple learn how to use self-hypnosis. If they find it difficult to move into that meditative state of mind on their own, there is the option to listen to pre-recorded audios that the hypnobirthing practitioner provides during sessions. The hypnobirthing client pack includes scripts for the birthing partner to read to the pregnant person, so they become the guide during pregnancy and birth, should this be the preference. However, a larger part of the hypnobirthing course is the antenatal aspect, birth physiology, which helps with body awareness, breathing techniques that correlate with neuroscience, birth positions that allow the body to move in the way it's designed to allow the optimum passage for the baby, an understanding of the 4 C's of mental toughness, so the birthing person knows how to prepare themselves mentally for the physical challenge of birth and more. Hypnobirthing should be all that a pregnant person and their birth partner need to prepare for birth. There are pregnancy and birth books I recommend if they have the time and interest. But for those that don't, a hypnobirthing course is adequate preparation. It's important to me that we as professionals use the correct terminology. If you have the skills to teach someone meditation, hypnosis, mindfulness or similar, this will almost certainly improve their birth experience. However, it is my belief that it should be advertised as such. I usually start working with a pregnant person and their birth partner when they're around 30 weeks gestation, 25 to 30 weeks gestation. It feels key to me that they know what they will learn. If they expect an antenatal course and do not get it, this could affect the birth negatively. If they choose to birth at home with few people around, this is a more natural setting. The negative effect of not knowing will be less severe. However, many people birth in hospital or medical settings. It is important in these situations that they can maintain the natural mind-body connection whilst birthing in an unnatural setting. Understanding of all circumstances in this environment is important for maintaining control of oneself and the situation. As I gain experience, my work evolves. In the 12 years I've been hypnobirthing, research has developed, medical practices have changed, and awareness of the importance of positive birth has increased. In hypnobirthing, we choose not to use the word pain. Pain is a danger signal to the brain. It alerts us to a problem or stops us from doing something damaging, such as touching something too hot, or moving a body part in such a way that it will get damaged. However, hypnobirthing is sometimes considered a tool to ease discomfort during labour. As a result, many hypnobirthing techniques focus on the management of physical feelings. From the onset of fertility to birth, we took the viewpoint that when the intention of the hypnobirthing technique is to manage the physical feelings, that is where the focus lies. The last thing I wish for is that their birth involves a strong focus on their physical feelings. We therefore chose not to use techniques such as glove anaesthesia to numb any discomfort. Historically, people chose hypnobirthing because they wanted a natural delivery without pain relief. They knew hypnobirthing as a tool that eased the pain of birth. However, at fertility to birth, we recognise that hypnobirthing is not about pain relief. Hypnobirthing is a way to prevent pain that occurs because of the fear of birth, rather than the birth itself. In the early 1900s, an obstetrician called Grantley Dick Reed would always give birthing mothers chloroform, a drug that rendered them unconscious. When a pregnant woman that he was tending to refused the drug, and after naturally birthing her baby said to him, "It didn't hurt. It wasn't meant to, was it, doctor?" Dick Reed started his journey of research into why women feel unnecessary pain during labour. In his book, Childbirth Without Fear, Dick Reed says, "There is no physiological function in the body that gives rise to pain in the normal course of health. In no other animal species is the process of birth apparently associated with any suffering, pain or agony, except where pathology exists or in an unnatural state such as captivity." What he did notice, however, is that if an animal in labour senses danger, the labour will stop. This is the result, during birth, of the fight or flight response. I think most of you here probably know that this physical response is intended to help us survive a dangerous situation by priming us to either run or fight for our lives. During birth, part of the fight or flight response involves halting labour, so that the birthing person or animal can fight or flee to safety, and then continue to birth the baby. Dick Reed said that if fear is felt by a person during childbirth, it will cause blood to be directed away from the uterus and redirected towards the muscles needed to fight or flee the dangerous situation. A result of this is that the uterus is left without oxygen and cannot perform its functions efficiently or without pain. Dick Reed named this observation the fear, tension, pain syndrome. He believed that by removing the fear associated with childbirth, women could allow the uterus to function normally, eliminating the pain. Any techniques during labour that help the birthing person remain in a default state, calm and in control, will enable labour to function efficiently. Simple self-hypnosis is a brilliant tool to use. It helps the person to keep their focus in the present, rather than panicking about the what-ifs of the future. Interoception training or somatic awareness, in particular mindfulness, helps someone to accept any natural feelings without judgment and allow their presence. Feelings that might otherwise be considered bad or unpleasant become welcome feelings of birth that will pass when the time is right. Labour is facilitated by the state of mind. Physical aspects are important, and during the hypnobirthing sessions, we run through optimal birth positions and the reasons for them. However, when a birthing person has a solid mind-body connection and can hear their innate instincts, providing they have the confidence to reject unnatural situations which do not intuitively feel right, such as laying on a bed to birth, they will birth as nature intended, and any unnatural environment surrounding them will not impede the birth. I hope you enjoy bringing this really important work into your world. If you have any questions, please do contact me. I love chatting to people, learning and sharing knowledge. I look forward to hearing from any of you for a chat so that we can do this. I feel grateful to you for listening and hope to meet you face to face one day. Thank you.